Ia, o le tāne watu se update o le tūranga o el tatou whaamai pe on pesi aile atunu nei. I le poti munumuni lea tau mai i nea solos furulua. Ia, wafe ono se lau fast food wha i cases lea ua ripotia mai i tonu le mautanga sengase. Ia, male atunu atoa. Mai nea numera ia lua se lau male lua sa wha marina over the last 24 hours until when this seed rep report was finalized. To date, luas fulu ia measles related deaths that has been recorded. That includes one fatality in the past 24 hours. Now, 89%, this is an approximate, of all these cases are in Polo, and notably concentrated in Vaimaunga, Faleata, West. And of these, the current admissions are children. Over 90% are mainly children. And also children are quite ill and has dominated our ICU care. There are currently 147 measles cases who have been inpatients in all health facilities throughout the country. Of these 147, 120 are all here at our main reference hospital, Tua. One at Tuasivi, Mandi Totan Filidua Hospital Tuasivi, one at Foilalo, and 23 at Leausa. Now, considering that the morbidity is mainly at the level of below 5 and up to 9. Even if you look at the related deaths, this is the most affected age group. Zero is 1 to 4 years. Now, of that, from all the tests, we have put in 122 laboratory confirmed cases of measles have returned. And routine testing for measles is no longer recommended at this time. So most of the issues now, we are managing the cases with a lot of care, especially with the children involved. And as I've said, our ICUs have been dominated by all the children. Even our negative pressure makeshift ICU from Australia are all children. That's our current outbreak for them. Ja, ole taibil ne wa fe on se la fast food fa pen fa ia le fa ia to we wanga senga sen mi sela wori potiel taimin nei mai lua se lau male lua wa to Leausa my last 24 hours it was a lau male lua. Up to this period on the 22nd of November, o mai anafi, o luas furu ia maliu, o whamawina. Mai, o le varis furu iwa pasene o le se lau le awhi ona su whane, o tonu o le motu nei o polo. Ai toa tele lava o le area lea le vai maunga, ia mawhaleata, leanga i toa mua mai lo toa no whasoro mai vai lele e aluanga i toa mua. Le tele nei ngase wa tau fia. Ia tele lava le whanau laiti. Se furu mantasi, taimi nesu mantasi, whanau laiti o lo tonu o la ICU. Mai o lo mawil tingaina. mai le se lau fast food fitu la fa ya toa o o lo ta fia ni tono fa le mai mai tono le tono nei a fia I masavai se lau luas furu lo tono ta to fa le mai to tua tasi o lo I to sidi ya tasi o lo fa lalo ai luas furu todo o lo le unuenga se lau luas furu ma le lua le au fai wa fa mawina mai wa I fa le so to e stadia wa fa mani e ma won misela al taimin nei le to fa to ina ko so fa yo ni test wa le wa lo wa pesida va fa ma yo mi selecto sa mo I fa mo ngala ia o le ai fa tu mawina o te de la to ma li diu mai tau sanga mai la lo mai le fa tau sanga anga ila ya masalo se ko update ta ko le ka ko fa ma ne fa laro
Boleh lo filma Leausa tulang ni tu olus boleh lo mati. O la zona fai tu pui pe o tu tele de fai tu.
Ele into pui o to tele.
Excuse me, sir. Do you mind telling us if you have, please, the numbers of how many people have been vaccinated at all of the new stations? Is there an updated figure at all?
We will give you a written update on that.
There will be an update that will be released later today, this evening, updated figures. That's how important you are to the government. We're going to try and give you regular updates.
Can we also get some data on how many were discharged? You know, you just told me about how many people are admitted, but has anyone been discharged saying that they're well? Can we get some data, out of how many in the hospital, how many have left the hospital, how many have been cured or, have come out? We're only hearing the deaths and how many people, but maybe can we have some data on how many have been discharged from all the centers in Cambodia?
Yeah, we can keep that, but we also are cautious in case people, it can be translated that the problem is controlled. But if you look at 1,644 cases all over since the outbreak was declared, and the case fatality rate, the mortality related, that's 20, and less all the admissions, then it should give an idea of, but we can give some exact numbers on that, but that's an estimate, and as I've said, we're very cautious presenting the success side, and then it might be translated that everything is good.
Is there a plan, please, for mobile clinics and such as what's been installed here in Apia in Savai'i as well, and where might they be, please?
Yeah, we are planning for Savai'i also.
Thank you.
But we will give that plan. The plan is being finalized today, with everybody being mobilized tomorrow. But at the same time, Savai'i is still continuing their outreach programs. All the district hospital remains fixed sites, and all are open from 9 to 8 at night. At the same time, they still have outreach team going out into the villages of each particular district. So we're going to beef that up, sending more teams there and providing fixed sites around the area where a lot of people go to, make the access more easy.
What is the situation, please, for those who were separated, families who were separated between Savai'i and Upolu and now may not travel under the state of emergency order? Are there exemptions made to reunite families because there wasn't warning given, or what would you like to do about that?
Are you saying there has been families who have been misplaced or
yes, so
displaced? Or
not misplaced per se, but they maybe were on the wrong island where their family lives for the day and then couldn't travel back because they're underage, for example.
But we haven't heard any complaints on that. I think most people now, they are looking at the bad side of the outbreak. If I am in Hawaii and more deaths are here in the pier, and outbreak is rife here in Upolu, as we've noted from our stats, then as a responsible parent, even if I have to spend time in Hawaii, in Samoa we have relatives everywhere, and they understand we have a problem here in our islands of Upolu. So I don't think it will be a problem, unless there are other reasons we are not aware of. But as of now, we haven't had any complaints.
If there are people, where should they go to the NEOC if they are concerned that they can't get on the ferry?
Then we will have to be addressed from there. But the proclamation has been out.
Leausa, can you just give us a comment regarding what strain of measles that we are dealing with and why is it so deadly?
There's any strains of the measles. So as far as we know, there's only one. That's why we can have this vaccine specific to that strain. So currently I think we have just launched a research looking at all the adults. So if they come, we will ask them if they can take blood. So we will do that assessment.
Bad reaction to the vaccination.
Mai le over the sfuru afere o tui. Ko kasi are kaka nga ele adverse. Ye foi lava ila au tui da ia lau koe mangu ia.
I'm not sure if you're able to comment. You closed, the bingos have been closed. So what is next if the problem doesn't get any better? Is there an intention to close other, nightclubs or movie theaters if the situation requires?
Well, that's where the proclamation acts. And we all know we have different interpretation of gatherings. But I think where there is a risk, it needs to be dispersed. It shouldn't be allowed or shouldn't be encouraged.
As well as helping out at the vaccination fixed stations, is it the police's role to, monitor public gatherings and be in public places and churches to make sure there are no children present under 19-year-olds? Is that what they've been expected to do?
Well, it's now law. Proclamation is a law, so police should be there to enforce the law. E fua I le taimi den tu ye o momoa. A vai tu momoa o la fato a tasino tausanga. Ia o anga va foi fento tu yo. Ai afa pe le na mata ro taimi en misela matua to amata tu. E sau fai lo tu. Fica lá within 30 days. Afa pe o akol masinga. Pele akol masinga ele kaulan ko tu e pa pele akol masinga. Talu o fai lo tu. MR por them. So if we like a pena.
Excuse me, is it the plan of the ministry to be vaccinating a second dose for the whole population as well, to be extra protected, and then also for the children 6 to 11 months who've had dose 0? Will they?
For the 6 months, when you become 12 months, you will still go to the regular schedule. You will get your regular MMR at 12 months. And then you have another dose, most mothers call it a 2-year-old dose. But it's usually 15 months to 24 months. So, but adults, as we know, this is an extra precaution. The question from here, if there is a new strain, that's why we're doing it. We're doing this research to confirm or not to confirm, and also at the same time we don't want to be behind. That's why we're looking at vaccinating all the adults also. But we are prioritizing we are prioritizing these age groups and especially non-pregnant women.
So just to clarify, sorry, there's no plan to do a second dose for the children and women, that vulnerable group that you're talking about? Are you wanting to do a
I don't think so. Not children above 4.
above 4?
I mean 2, because we are expecting that if you've been vaccinated at 6 months, then by 12 months you'll get your regular, and then around 2 you'll get them. That's it. But the rest, there shouldn't be a second dose of MMR.
Even with the low rate of vaccination that we had already prior to the outbreak, are you not wanting to do a second dose after, I don't know, in 6 months' time for this? I'm thinking like a sort of 3 to 7 age group that for the last 5 years have had low rates.
But they are becoming adults. Is that what you say?
No, the 3 to 7-year-olds who are still in that bracket from the last 5 years that women have had their second dose.
What we will do is, depending on the coverage. Remember, the vaccination is an ongoing thing. You know, after this outbreak and the mass vaccination, then we review our data and we'll continue. And now I think government is going to make it mandatory for all school children before they enter school. They have all their vaccinations up to date. So there's another checking point.
The worst is yet to happen.
Ele o mawhai o ngā particular kei mingi. Ele o whai fo i o ngā mautinoa ua whai fo i lalo. Paul mea le wa e wao le ai whaupopo ka fokis. E aso e sawe kau le ingi o mais. E aso e sawe o sunu. And we've yet to see Savai, because there are cases in Savai. So we are doing everything to control, to protect the island. O pepe ia I lalo mai o le ngo masina. Wa afa pe tuile tina, ia ona pepe. O le vai ngā ia nesa protect ai pepe nei. O le immunity o long tina le antui. Pasta ni ke mi nei tono el manava ia ma taimi e fa susoi. Ia pe tai ava pela o tina lai lo taimi nei le feson tui. E ta wela na va ve. Ili taimi nei sa u tono por taimi fa yan tala vai. Taimi nei sa ro fa lon tui. Sosoani. E foi ia protocol le wa matungalu e foi mane male un FPA ne fa vasenga I wa te mini to tolu la to mai tanga le to fio mod misela ya ne foi la fa fa pito wa e se foi to ranga le to inga ono le wa tanga te to so le foi la fa fa pito a le vai inga o la to a ponenga na o le foi wa ia ia sto inga tu fa pito tu so mai sa ole antibody tu tono pepe da ke le ati peito ngame but we are still doing it.
Excuse me, please, are you able to provide us some clarity on the matter of the private clinics not vaccinating any longer and why the ministry has chosen, or the emergency operations has chosen not to enlist them in the mass vaccination campaign?
We are providing documented and a written response to that, so that there'll be no misunderstanding. But what I can say now is all about safety, and we don't want to repeat any other problems that or any mistakes from the past. So it's all about the safety of the vaccine. That's why I think access-wise can be done, but then there are other issues related to this. So we are hoping that we will provide a written document for clarity and understanding of the public.
And may I ask please, do you know what will be the consequences for anybody who doesn't, excuse me, obey the order from police not to encourage people to not vaccinate?
I think that would be for the court to decide. And depending on the charges, the AG's office will charge those people if they have evidence, all those. So it's going to be a legal problem.
You don't have a sense of what could be on the line for people?
We are concentrating on our problem in health.
Already not a fear, multiple family members, but to or yes, for one, I never been to a CRP isolate my nice fan now here, or also for beer in a year. If I teach, I need to love a baby, so if I'm my nice fan now here, but
only ainganera e unika foile ainganera in the sense o ma foi mai ele se singa se stuma me o si akile vai si aki uma e foi la turanga mare ale la e turanga si ainganera e ma tua foi u te lauri ilme e ya te de foi fanta foi vai e tu a pero foi e ma foi un review la ku e ku la ngana e ole se si al fan ole mo mari o ele uma treatment for ma o por isso falo la veris to ngai issues la ele fa pero foi la wa ye ma ka wa ve so sangi ko so sangi la ko small status of living I never matter why il turanga pe ma fuai le tau le pola no ma fuai le turanga
ala turanga pola no pio ale pe e mo lo fo tua musu roi fa mai ale ese turanga pola le tsanga fa ma usia ele tu pe ave fa tadi o tu wale mai o to isto mi tio na de
no le tele o le moenga le na to fa mo le tele o ngase na vai tu fa ye fo ye fa sa Leausa leisi e to fo ye tu al falma o tinga ina o tele fo yo ngase ye tu mai ma liu ngase fo sa ta un fai fo tu ya no mai le falma i tu nga fa le tonu ya le o tu puoi fare la fe le ma fai na fatu la forina ya tawol sinai man ma tu ai pudela tu to fitin altilo menane le ho la tau ma fai ina ya watu se fa mana manga e ma tu e fua e la tu fai uma ya oni so no ma ve un tonu i meni ai leo yeso la to mala manga ma me fua e la to fai uma fai ai pe se io tele no temne o le fai si va to pole o va fe tele ta ina il tele to na tai meni o no le me ane e ta to wo no ma o fo va fe ma fo ngi do ma le skaya a tele o fa va ini e tele ai e alo na tai mi e tawana lava stai mi fina o maltino ya fa pena foi le no mo malo si per
Last question.
Are you able to provide any details about the aid coming from Tahiti, please? We understand that Hercules is coming.
There's a team from Tahiti arriving today. I can confirm that. 2 doctors and 1 epidemiologist. They've also offered vaccines, but we sort of hesitant, and I think it's going to be replaced by the vaccines we have because all the vaccines are in French. So WHO has recommended that if they can, that same amount will do the exchange for what is available. But we appreciate that the efforts from our neighboring and also reflects the the teamwork of this Pacific Island nation, especially with the heads of health meetings and health ministers meetings, where Tahiti is also a member.